Hello everyone, my name is Stephanie Spicer and I'm a Lymey. I'm not a doctor and I've also never been pregnant, so much of this video is based on the research I've read and the experiences of others. I'll put links in the description in case you want to read more on your own. This is a big subject and we can only really scratch the surface of the information in a short video like this. In this video, I'm going to cover two main subjects in relation to Lyme disease, menstruation and pregnancy. I'll bookmark the video in case you're more interested in just one part. Lyme disease can cause heavy, irregular, delayed, skipped, or extremely painful menstruation. My symptoms include migraine, poison-like pain in the thighs, feeling freezing and unable to get warm, reduced vision and hearing, extreme pain and fatigue, appetite loss, and anemia. I had never had any problems with my period until one day, I think I was 18, suddenly I got terrible cramps. From that moment on, every period got progressively worse, until the pain was almost unbearable and I was taking way more pain medication than recommended. Periods have been the peaks of my symptom exacerbations and have become something to dread and work around. The first period I had after starting treatment I noticed was significantly easier than the last one had been. This inspired me to develop a treatment plan of 1 treatment per week for 3 weeks and then 1 week off during my period. I continued to notice improvement every month, and this was the clearest sign to me that treatment was actually working. My periods continued to improve until I became lax with treatment a couple of years after starting, thinking that maybe I didn't need them as much anymore since I had improved so much. That was a big mistake, as the menstruation hell returned in force, and I feel like I've been playing catch-up ever since. However, last month I did actually dare to do a treatment before my period was over, which was something I had never done before. Since herxing has decreased in severity recently, I wanted to try this because menstruation is actually a good form of detox. So I thought that combining it with treatment could help speed up recovery in that part of my body. Previously, when I had timed a treatment too close to my period had been delayed. Maybe because dealing with a period and a herx at the same time was too much for my body to handle. It's important to remember that although Lyme symptoms are worsened by menstruation and vice versa, just managing the symptoms isn't going to solve the problem. It's Lyme and its co-infections that are the cause, and until these are addressed, we can't expect improvement. In the question of Lyme disease and pregnancy, we find a lot of similarities with syphilis, which gives cause for caution, and we also see a lot of disagreement by the experts and in the research. Some studies seem to clearly define adverse outcomes, while others claim to find no correlation. What we do know is that Borrelia burgdorferi can cross the placental wall from mother to child. Babesia, Bartonella, and Mycoplasma can also be transmitted mother to child in the womb. Animal studies have shown adverse outcomes in Borrelia-infected white-footed mice, dogs, cattle, horses, and a coyote, the most common being inability to conceive and miscarriage. The Limelight Foundation, which provides treatment grants to children and youth with Lyme and other tick-borne diseases, claimed that more than half of their recipients over the last 3 years were likely infected in utero. About 2/3 of women with gestational Lyme disease describe their pregnancies as difficult. Maternal toxemia manifests as severe and unremitting fatigue, brain fog, cognitive problems, hypertension, and proteinuria. The studies that have found a correlation between gestational Lyme disease and adverse outcomes recorded maternal toxemia, fetal death, fetal maceration, hydrocephalus, cardiovascular anomalies, neonatal respiratory distress, jaundice, intrauterine growth retardation, cortical blindness, sudden infant death syndrome, low birth weight, syndactyly, failure to thrive, neurological dysfunction, developmental delay, and learning disabilities. In 1995, Dr. Tessa Gardner contributed over 100 pages on Lyme disease to the 4th edition of Infectious Diseases of the Fetus and Newborn Infant. This study, which observed 263 cases of gestational and/or congenital Lyme disease, including 4 of Dr. Gardner's own patient cases, demonstrated that when infected mothers took aggressive antibiotics during pregnancy, they significantly lowered the risk factors. Treating infected infants directly after birth did so also. Normally, medical texts are updated in subsequent editions, often by other doctors. However, in the 7th edition, published in 2011, only 13 pages on Lyme disease, including references, were presented by Drs. Eugene D. Shapiro and Michael A. Gerber. The WHO also removed congenital Lyme from its International Classification of Diseases in 2018, stating that there is not sufficient evidence to justify a separate statistical category for congenital Lyme disease. The text of Dr. Gardner's study is available in full at lyme.org. I'll present a few extracts here. Data indicate that the prognosis of gestational Lyme borreliosis is good if the infection is recognized promptly and treated aggressively with antibiotic therapy aimed at crossing the placental barrier. Antibiotic therapy for gestational Lyme borreliosis may be successful, partially successful, or unsuccessful in preventing congenital Lyme borreliosis. Outcome probably depends on the choice, dose, route of administration, and duration of antibiotic therapy, as well as the trimester of the gestational Lyme borreliosis and the duration of infection before initiation of antibiotic therapy. If maternal Lyme borreliosis was inadequately treated, even an infant who is asymptomatic at birth may be at risk for congenital Lyme infection, and prompt antibiotic therapy should be started at birth with either intravenous cefotaxime or ceftriaxone for 2 to 4 weeks. If the infant is already symptomatic at birth, this indicates more severe infection, and prompt antibiotic therapy is essential and may be life-saving. The longer duration of 4 weeks may be preferable because of concern regarding the risk of late chronic Lyme borreliosis with its associated developmental and neurologic deterioration. For the infant who either presents with or later develops signs of late congenital infection, intravenous therapy with ceftriaxone or cefotaxime for 4 to 6 weeks is recommended. Infants of mothers who had gestational Lyme should be monitored for symptoms as they grow. Ideally, the placenta should be culture tested for Borrelia, but I'm not sure how practical this actually is in real life. Oddly, Lyme Borrelia infected fetal and newborn tissues do not demonstrate inflammation. The information I was able to find on breastfeeding was inconclusive and contradictory. What we do know is that Borrelia have been found in breast milk, but so far there have been no documented reports of transmission of Lyme via breastfeeding. There are some who claim a connection between Lyme disease and autism. According to the Lyme-Induced Autism Foundation, up to 90% of children with autism are infected with Borrelia. However, this claim has not been supported in the scientific literature up to this time. And I'd just like to put in another word for antibiotics. I can understand not wanting to take antibiotics during pregnancy or giving them to a newborn child. We know that it can lower the infant's immune response and increase their chances of infection and hospitalization. But there are circumstances where we need to choose the lesser of two evils. I'm all for natural medicine, but there are situations that call for more aggressive action. For example, acute Lyme and pregnancy. These are not ongoing situations, they are events. Sometimes I see people posting in Lyme disease groups, I got bitten by a tick and I have a rash. How can I treat this naturally? And I'm like, go get 4 weeks of antibiotics right now. If they fail, unfortunately, you'll have plenty of time to try natural options later. In my opinion, it's the same with gestation. It's better to risk lowered immune response than stillbirth, miscarriage, or birth defects. If you're concerned about your baby's compromised immune system, remember that skin-to-skin care is particularly useful to develop a healthy microbiome in the infant. Whether you're pregnant or not pregnant, whether you're a woman or a man, seek treatment. The best thing we can do for ourselves and for any future offspring we may have is to work relentlessly towards recovery.